I want to start with writing that you did 5 years ago. So 5 years ago, you had a Nature paper. You were one of the first authors. You were co-first author on this Nature paper. And probably a lot of listeners know, but maybe not 100% of them, that Nature is one of the most prestigious peer-reviewed academic journals that you could be published in. And as you mentioned to me before we started recording, it has a pretty innocuous title, this article. The title is International Evaluation of an AI System for Breast Cancer Screening. But that kind of belies why this is really interesting, doesn't it, Varun?
Yeah, there's a couple of things that's really interesting about this. So the team at the time was really interested in how we can use machine learning for various types of medical imagery. And this specific piece of work is for mammography imaging, which, it's relevant to a lot of people's lives every year. And what we demonstrated in this paper is that you can use a deep learning system to predict biopsy confirmed breast cancers 2 or 3 years, depending on the country within which you're making the prediction in, because different countries have like different screening guidelines and so forth. You can predict those biopsy confirmed cancers a few years in advance, and you can do this better than expert human radiologists. And so we benchmarked this on a very large retrospective screening data set sourced from the US and the UK, totaling like a few 100,000 patients or something like 100 and something thousand patients, like details in the paper. And we also did a separate reader study with expert radiologists who had nothing to do with the data collected, and the model beat all of them as well. So the team was really excited for this to get published, and I don't know. I think AI has a lot of potential for medicine and making it more accessible and making it much more reproducible. So yeah, it was just that was a really exciting thing to get the opportunity to work on.
Yeah, there's some other reasonably well-known names as authors on this paper. Demis Hassabis, Mustafa Suleiman, co-founders of DeepMind. Pretty cool, man. Um, and yeah, this is a good example of the kind of it's an interesting situation. Actually, we can tie this into the Wise AI idea a little bit because here in this 2020 paper, you're describing a system, an AI system that can replace humans on a task. But this isn't just about replacement. This is about augmentation and complementation, right?
Yeah, that's right. Because you'll find that, I mean, this wasn't really in the paper, but you can generally find that humans and AIs, they have different strengths and weaknesses, right? Like I think it's an area of active research. Frankly, I'm a bit out of the loop on the literature on breast cancer screening because I've been working on different things in the last few years, but um, there is a world where it can be the synthesis can be incredibly powerful, right? And I think that's really what excites me, and just using that. And there are countries, where like one way to look at it is the ratio of patients per mammographer in that country. Again, it's been years, so I don't have these numbers on me, but you can imagine that there are some countries where that ratio is pretty small, right? And then there are other countries where that ratio is actually, like there are many patients per mammographer or radiologist. And so I think there's just something really cool about the possibility of using technology to substantially improve access to what could potentially be life-saving screening for lots of people.